I love my job because I get to do something that is contributing to a better future.
Good evening. Another record-breaking day for COVID as Omicron begins to spread at an unprecedented rate. Over 88,000 new cases were discovered in the last 24 hours, and the new, more transmissible variant will soon be dominant across the country. So is enough being done to stop Omicron? And what exactly do we know about it? Well, over the next hour, we will have the expertise of a panel of guests, including Professor Paul Moss from the University of Birmingham's Institute of Immunology, Dr. Raghib Ali, an epidemiologist at the University of Cambridge, who advises the government on COVID disparities, Dr. Claudia Paoloni, she's president of the Hospital Consultants and Specialists Association and a consultant anaesthetist, and Simon Calder, the Independent's travel editor. Well, throughout the day, we've been getting your questions about Omicron, and we hope to answer as many of those as possible. This is our Omicron Q&A special.
We need the UK government to act urgently.
We're not closing things down. We're not asking people to cancel things.
Omicron is currently running faster than even the fastest rollout of vaccines.
People should be cautious and they should think about their activities in the run-up to Christmas.
Where we're going over the next couple of weeks, the rate of increase is going to be, I think, fairly impressive.
Because advisors are now running the show, I'll bet none of them run businesses facing complete ruin as a result of what was said last night.
British tourists are to be banned from France from Saturday morning. Were you planning to go to France for Christmas? Forget it.
Hello. Well, Professor Chris Whitty warned earlier of a series of record-breaking days this winter as we start to see a wave of Omicron cases. Today was one of those days with over 88,000 cases identified. Scientists believe each person infected with the new variant is passing it on to a further 3 to 5 people. It will soon become the dominant variant nationwide, and in Scotland, that will be as soon as tomorrow. Hospitalisations from Omicron remain mercifully low. That's thanks to the strong vaccine rollout. But with its rapid spread, will that last? Will it be enough? Well, we'll be speaking to that panel of experts in just a moment. But first, our correspondent, Alex Rossi, reports on hospitals under pressure.
Recovering in her hospital bed, it's been a terrible 10 days for Lisa King. Her breathing is slowly returning to normal, but it was touch and go at times. The 51-year-old wishes she'd had the vaccine and is now urging others to get the jab.
I've never experienced nothing like this in my life, and it's nothing I'd want anyone else to.
How are you feeling now?
Quite emotional.
It's been tough.
Yeah.
The flow of COVID patients at this hospital has been relentless throughout the pandemic, but 2 epidemics coming now on top of each other, Delta and Omicron. They are preparing for worse to come.
This is the intensive care unit where the most critically ill patients are brought for treatment. Many of the people here are on ventilators. Now, at the moment, the hospital is coping, but the fear is, with the Omicron variant taking off in the community, that hospital admissions will soon rise sharply.
The patients here most likely all have the Delta variant. In one of the beds, we meet David Colley, a fit 39-year-old. He has been double jabbed, but still ended up in ICU.
Yeah, I was on the ward for 2 days and I've deteriorated, so they've had to bring me in here. I've been in here 4 weeks now today. So
4 weeks?
I've been in here. Now I go to the gym 3 or 4 times a week, mountain bike, never off sick. It's just knocked me off my feet. Now, as you say, you don't think it's going to happen. I've been double jabbed as well. May and July I was jabbed. And I did say if I hadn't been vaccinated, I probably wouldn't be here.
You replied?
Yeah.
For the medical staff, these are frustrating days. The vast majority of patients here have not been vaccinated. With another big wave of infections coming, they are worried about the next few weeks.
So all of the meetings that we've attended insofar as the network is concerned, where modelling is taking place, the message is clear that this looks like it's the calm before the storm.
Government scientists say Omicron infections are now moving at a phenomenal pace. And at the start of this new wave, medics here are already exhausted.
Initially, it was all hands on deck. Everyone was full of energy. But as the time's gone on, it seems like there's no ending to it.
The infectiousness of Omicron also brings new challenges. As well as making more space for patients, there is the risk to those working on the front line.
We are absolutely worried about not only just having enough staff here, but also the impact that it has on staff who are well, having to work additional shifts, having to work that flexibility, and to show that resilience that we ask again of our staff again and again.
No one here knows what Omicron will bring over the Christmas period. They hope the explosion in infection rates will not lead to a surge in admissions. But the data does not look good. Alex Rossi, Sky News, Wolverhampton.
Well, there you go. That's what it looks like on the COVID wards, on the ICU wards. Those crucial days, 10 days till Christmas. Let's talk to our guests now about what those might look like. And we have our first question. What are the symptoms of the Omicron variant, and are they easily confused with a cold? I'd like to put that to Dr. Raghib Ali, first of all, please.
Good evening. So we've got some data just today, actually, from the COVID Zoe app, which has millions of people using it, to look at the symptoms and comparing those for Omicron versus Delta. And also you'll see how common they are with the cold. So the top 5 symptoms that have been found are runny nose, a headache, tiredness or fatigue, can be mild, can be severe, sneezing and a sore throat. And of course, all of us would recognize those as very typical symptoms of a cold. So the best guess really at the moment is that if you have those symptoms in London, particularly where Omicron is obviously or has been leading the kind of way in London, it's where it's most prevalent, over 50% of cases now. If you have those symptoms, it is more likely that you've got COVID, and particularly Omicron, compared to a cold. So if you do have those symptoms, it's really important that you do isolate yourself, take a lateral flow test and a PCR test as soon as you can. So book a PCR test as soon as you can to check whether you have got COVID.
Well, let's just take that in. If you are in London and you have those symptoms, runny nose, fatigue, etc., you are more likely to have Omicron than a cold. Let's just let that sink in. So do get those lateral flows. Second question here. I've had my booster quite recently. How will that affect my immunity against the variant? I'd like to put that to Professor Paul Moss, please.
Thanks very much. An important question. Yeah, I mean, obviously the baseline vaccine was 2 doses in the UK, and at one time we felt that might get us through the winter. And there was debate about boosters. We introduced that a few weeks ago. We now know with this variant that the booster is a vital weapon. The reason is because I think, as many of your viewers will know, that this virus has mutated so much that it can evade perhaps up to 40 times of the antibodies that you had previously that protected you, maybe down from 100% down to 2 to 5%. So you've got to get that level up. And boosters can do that. They can boost antibody levels by 20, 30-fold. So they're a very powerful weapon. And we've also seen some real-world evidence from South Africa that boosters can give some, perhaps 70% protection against symptomatic infection. So they're vital, and it's great to see the booster campaign working so well across the UK.
And we were just a follow-up question on that. When does the immunity kick in at its highest? How long do you have to wait before that booster immunity really kicks in?
Well, you've already had 2 baseline vaccines, so you're going to get a rapid response within the first week. So yes, I'd expect protection to be within the first 1 to 2 weeks.
OK, brilliant. Thank you very much, Professor Moss. Now, listen, as we are talking about boosters, we're going to take a short pause there in the questions for a second. The Health Secretary has just given an update on the booster rollout. Let's have a listen.
Well, look, since we learned about this new variant, Omicron, our strategy has been to buy time to assess it, and also to, of course, build our defences. And vaccines still remain our best form of defence. Now, we know now that 2 doses of the vaccine are not enough against Omicron, but 3 doses provide excellent protection. And this is truly now, it's a national mission. It's a race between the virus and the vaccine. And that's why I was particularly pleased to see that yesterday we had our best booster day ever so far. 740,000 booster doses throughout the UK, hitting a new total of 25 million. And I want to thank everyone that's been involved in that, the NHS, of course, the military personnel helping, all the thousands of volunteers, and of course everyone that is enthusiastically coming forward, because this really is our best form of defence. We can see that it's working, and we need more and more people to keep coming forward, take up their chance to get boosted by the end of this month for all adults, and also really to know that if they answer that call from the NHS, they are protecting themselves, they're protecting their loved ones, and they're protecting their community.
But we don't know just how effective the booster programme is going to be, and Chris Whitty today implied that there could be new measures, new restrictions, if it turns out that the booster isn't quite as effective as we all want it to be. Can you tell us what options you're looking at so people can plan their lives over the next few weeks?
Well, we've taken measures this week. There was a really lively debate in Parliament, but the measures are there now. They are in place, and those measures are going to help and give us a level of protection. But most importantly, they help us buy time, and that time is being really sensibly used to really turbocharge this booster programme. Now, of course, that depends on the fantastic work we're seeing from the NHS and the volunteers, and they're delivering with this record number of booster doses. We want to keep seeing that number go up and up, but also with people coming forward. And I would just encourage everyone to come forward if they're eligible and get protected.
Could you answer the question, though, Secretary of State? Can you, for instance, rule out any more restrictions in the next week?
Look, we've been really clear about this all along. The measures we've put in place are the right set of measures. We, of course, keep that under review. And, I've said that, and I'm happy to say it again. Of course, we have to keep the situation under review and keep looking at the data. But right now, what the data is telling us is that boosters really make a difference. They really, as you would want, they really increase your protection dramatically against this new variant. And that is why it remains our best form of protection.
Nicola Sturgeon has announced tougher restrictions in Scotland, more restrictions expected in Wales tomorrow. Why are they wrong?
Well, look, we've seen throughout this pandemic, different parts of the UK will have slightly different policies on mixing and things like that, and that's for each nation to decide. But the one thing that, whether it's Scotland, it's Wales, the UK, any part of the UK, the one thing we all agree on is the vaccine programme, and we've seen everyone really turbocharge their booster programme in particular, and that is something that everyone is rightly focused on.
The Metropolitan Police have said that they are going to interview 2 people in connection to breaches of COVID rules that happened at Conservative Party events. When you see that news, which has just broken, how do you feel?
Look, I think, first of all, what the police may or may not do, that's an operational decision for the police to make. But in terms of some of the news that we've seen recently, especially around Downing Street and allegations of what may or may not have happened, what I always think is you need to establish the facts. And I'm pleased that Simon Case, the Cabinet Secretary, has been asked to do just that.
And can we expect a report anytime soon?
I'm not sure the exact timing of the report, but I know Simon Case would take this issue really, really seriously, and I know he will look at it thoroughly.
Health Secretary Sajid Javid speaking there with an update on the booster programme just moments ago. We're going to get straight back into your questions to our panel of experts. And interestingly, the Health Secretary there highlighting the difficulty for people making decisions ahead of Christmas because the data, to a large extent, isn't fully in yet. So decisions are having to be made on incomplete data. With that in mind, we've got our next question. Are hospitals prepared for the normal rise in hospital visits at Christmas time and the rise in Omicron cases? So there's sort of 2 questions within that. Let's start with the first part of that question. Dr. Claudia Paoloni, you obviously are at the coalface of this. Are you expecting this Christmas the normal rise in Christmas visits, given that many people might decide to stay at home and not engage in the normal socialising and partying that might lead them to end up in hospital?
We have to remember that the hospitals are already under pressure. If you look at the news that's been coming up in the previous weeks, we can see that ambulances are queuing up, and every winter we fall under pressure. We run very high occupancy rates, higher than a lot of other European countries, and we don't have as many hospital beds in the acute service compared to other European countries. The reality is we only have 100,000 acute beds in the UK, and so that is a shared pressure for everybody. We have to treat not only COVID cases, we have to treat all the other urgent cases that come in with life-threatening conditions that need quick treatment. And at the moment, that is also a problem that we're going to have to manage. So we are indeed very, very worried.
OK. Let's put the second part of that question to Dr. Raghib Ali. Given what you know about Omicron thus far, how concerned are you about the state of hospitals over the next, we could say few weeks, but beyond that?
So what we're seeing again is London is really giving us the best idea of what's likely to happen across the country in the coming days and weeks. And what we've seen in London is a rapid rise in cases. And we have started to see an increase in hospital admissions as well in London. They're up about 50% over the last 2 weeks now. Some of that is still Delta, so we still have the Delta variant, and that's causing the majority of hospital admissions across the country. But in London, it's probably the proportion of Omicron cases and hospitalizations is increasing. The key thing in terms of the coming days, as you've mentioned, it's important that people that need to be in hospital for whatever reason, if they've got symptoms or signs of seriousness, they must come to hospital. We don't want to see what happened in the first and second lockdown and first and second waves, when many people stopped coming into hospital and were suffering at home. So it's very important that people continue to come in, and of course to come in with symptoms of COVID as well if they're seriously ill. But the key thing in the coming 2 weeks is what will be the rate of hospitalizations of those Omicron cases, and we don't have that information yet. We've got some data from South Africa, of course, and also from Denmark, but it's not directly comparable to our situation here in the UK. I mean, in the UK, we have got very high levels of population immunity, mainly from vaccination, and particularly in the older age groups, which will protect us. And we do know that if you have 3 doses, you have significant protection, at least 75% for symptomatic infection, and it'll be higher than that for hospitalizations. So that will help us. But the thing we're worried about is if there's a very significant number of cases in a very short period of time, that could lead to the number of hospital admissions that would really put the NHS, or hospitals in particular, under great pressure. And that's what we're trying to avoid.
OK, thank you very much. I'd like to put this question, because it slightly ties into what we were talking about with Professor Paul Moss earlier. The question is, will there be a need for a second booster soon? So that would effectively be a 4th vaccination. What are your thoughts on that?
There's a lot of debate already about future vaccine policy. As I said, we thought we were going to be 2, and now we've got the threat potentially of recurrent vaccines, and will we need them? I mean, just reflecting on our current booster policy, as we just heard, it's super in many ways. Over 25 million boosters given, and in the older population, who are most at risk, we're getting levels around 90% booster uptake. So we're doing quite well with our 3rd booster. In terms of your question, will we need another? Let me just talk a little bit about a group that we tend to forget a bit, which is the immune suppressed patients, which are up to about 3 million people in the UK. They've already had 3 primary doses, whereas most of the general population had 2. So they've had 3, and they're eligible now for a booster in 3 months. So they'll be having their 4th very soon. As for the rest of the population, another booster. We just have to assess it. We do need more research on this. And so what we've been doing in this country is we've got a lot of patients we're following to look at the level of the antibodies and cellular responses over the next few months. As I said, when we think of the booster that we've just currently giving, it's not really something that's holding our immunity at a certain level. It's taken it up to an extra level. It's possible that that 3rd booster may get us through for quite a long time, but it'll be very important to see how it clinically protects against infection and severe disease.
All right, thank you very much. That's very clear. Professor Paul Moss there. You are watching a Sky News Omicron Q&A special. Coming up, as interest rates rise, Omicron looks set to only worsen the issues. What can we expect in the new year? Do stay with us.
So the opportunity cost of not only being a mortgage prisoner, but that additional rise, you can't even put it into words at the moment. It's terrifying.
Well, it's worth noting, first of all, this is a different app to the one that shows your vaccination status. There are 2 apps here, and this is the contact tracing app. People have downloaded this app. The idea is if you get a positive PCR test, you can then use the app. You can hit a little button that says, please let my close contacts know that I've tested positive, and they can then take the appropriate action. And obviously, as you'll remember, this resulted in the so-called pingdemic that happened over summer, when as many as 100,000 of these alerts were being sent out every day. But it is a key weapon in fighting the spread of coronavirus. So the question is, how many people are still using this contact tracing app to alert their contacts to a positive test? And the figures I've been looking at indicate probably not enough. In England and Wales, for example, only about 50% of people who've downloaded the app are using it to alert their close contacts. And north of the border in Scotland, things are even worse. It's only about 1 in 5, about 20% of people who've downloaded the app are using it to alert their close contacts. And that's really important because, as you'll well know, in Scotland, what they've decided is if you are close to somebody who's tested positive for coronavirus, you yourself must isolate until you've passed a PCR test. Well, the question is, How do you know you've been close to somebody who's got COVID? One of the answers to that, a key answer, is through the app. There are other ways of finding out if you've been close to somebody who's tested positive. So there's the NHS test and trace system, but that's quite labour intensive. The idea of the app, it was less labour intensive, more widespread way of getting the word out. And according to these figures, not enough people are using the app in the way that it was intended. And that's obviously going to have a knock-on effect in terms of isolation.
This monastery is under the protection of Russian peacekeepers. I'm Diana Magnay and I'm Sky's Russia correspondent, based here in Moscow.
They can't arrest everybody.
ba ma dalee commencé liggéey bi yokkute bu bari am nañ ko ci.
Welcome back. Now, the Bank of England has announced a rise in interest rates from 0.1 to 0.25%. It follows a recent surge in inflation, which rose to more than 5% last month. Well, in a moment, our expert panel will be back to answer all your workplace COVID questions. But first, let's go to our economics and data editor, Ed Conway. He's going to explain why rates are on the rise and how Omicron could only add to the problem.
Once again, just before Christmas, the economy is frozen. No lockdown, no emergency support, but hospitality feeling the effects of Omicron.
We're told to stay open, but we can't afford to stay open and no one's coming. So you're essentially condemning a whole industry to just sit still.
This restaurant has had to close its doors just before what was supposed to be the busiest time of the year.
It's sort of our Black Friday moment, those last 10 days of December, when you turn into from negative into positive, because there are so many costs involved with running a restaurant. So those last 3 weeks are really key.
But infections are not the only thing rising fast. So too are prices. And in the face of that, the Bank of England has surprised markets by raising interest rates from 0.1% to 0.25%.
We have to take the action that we think will do the job to address and tackle the inflationary pressure, particularly in the medium term. We just have to do that, I'm afraid. And obviously we have to take into account activity in the economy. But I should say, employment in the economy is now very tight.
If you've got a floating rate mortgage or savings product, you should notice the change soon. But for most households, the direct impact should be minimal. If you're after one chart that shows why rates are going up, it's this one, inflation, the very thing the bank's supposed to keep low. On the left, you can see the high inflation 90s. Now look at the right. The bank now thinks average prices could be rising at an annual rate of 6% by next April. That would be the highest rate since 1992, when interest rates were over 10%. In short, the bank's betting that the risks from inflation outweigh the risks from Omicron, which is a bold call given how little we know about what's coming in the next few weeks. And it's a big moment because while this may be a small increase, it's potentially just the first of many. Higher inflation, higher interest rates, just as many households around the country are feeling perilously squeezed. And few households are feeling it more than so-called mortgage prisoners, hundreds of thousands of people who simply can't get onto a cheaper deal. John is trapped on a 4.8% mortgage and fears it'll now go above 5%.
So I would say it's going to rise again, so you've got that in the back of your mind also. So the opportunity cost of not only being a mortgage prisoner, but that additional rise, you can't even put it into words at the moment. It's terrifying. It's going to affect, not only does it affect us every month in the money we have to pay, the opportunity cost affects our children, you know, and all the things that they should be doing that we can't afford to do because we're paying more for a mortgage.
COVID, Omicron, higher inflation, and now interest rates. Not the presents anyone asked for, but once again, Christmas is looking complicated. Ed Conway, Sky News.
Well, straight back to our guests with your questions to put to them. And this one I'd like to put to more than one of you. So if it's possible, just try and keep it short. I know that's hard because there's a lot to get in there. So the question is, I have a reasonably... I'm so sorry. The question is, the Test and Trace app has been called a key weapon against COVID. So why are we not being encouraged to turn it back on? And I'd like to start with Dr. Claudia Paolini on that. Would you like to see it being turned back on much more?
I think one of the difficulties you've got is as soon as the virus is transmitting as quickly as it is, and so many people are infected, it becomes a lot more difficult to actually work. So the contact tracing, for instance, becomes more difficult. It's the numbers, it's all around numbers. And I think the best things that we can do as individuals, wash our hands, keep our distance and put those face masks on. I can't emphasize enough how that's really important for people to do.
Dr. Raghib Ali, we're hearing reports that some of those who are testing positive with Omicron don't have the app installed on their phone. It's hard to get their contact traces and to get in touch with them. How much of a problem do you think that is?
I think one of the reasons people stopped using it is because of the so-called pingdemic over the summer, and people are worried that they won't be able to go to work or to attend events. And obviously with Christmas coming up, they're even more concerned. But the rules have changed now. And if you are contacted by the Test and Trace app or get pinged, then you've got the alternative of taking daily lateral flow tests. And as long as those tests are negative, you can carry on with, with your work and other engagements. So I would encourage people to use the app. And of course, if they're contacted by Test and Trace, then they should follow those rules and take those daily lateral flow tests.
OK, and I'm seeing nodding from Professor Moss there as well. So try and use that app if you can. Well, listen, as we're talking about the health of the economy just earlier with Ed Conway, we've also heard from the Chancellor, Rishi Sunak, about supporting businesses at this critical time. Let's have a listen to him.
Well, I appreciate that it is a difficult time for the hospitality industry. That's why I was on the phone earlier today with various industry leaders from the hospitality space. And the good news, I would say, is that there is existing support measures in place to help the industry. For example, until spring of next year, most businesses in the hospitality industry are only paying a quarter of their normal business rates bill. They are benefiting from a reduced rate of VAT all the way through to next spring. And thirdly, there is about £250 million of cash sitting with local authorities that's been provided by government to support those businesses who need it. And my immediate priority is to make sure that that money gets to those businesses as quickly as possible.
Well, there you go. You heard from the Chancellor. Back to our guests, back to your questions that are coming through thick and fast. We have one here that, again, I'd like to put to a couple of you, so try and keep it brief if you can. It's a tough one, this one. My boss is ignoring work-from-home guidance because he thinks Omicron is mild. Why isn't the government introducing mandatory restrictions? Let's start. Professor Paul Moss, you've attended some of those SAGE meetings, given advice, talked about these sorts of issues. Why is the government not giving stronger advice so that people aren't pressured into situations that they potentially could be uncomfortable with?
It's a very, very important question. I totally agree. People should not be pressured. There's certainly not enough evidence yet to know that this virus is mild. It's far too early to say. As Professor Chris Whitty said yesterday, we know a lot about the virus so far, and most of it's bad. So I think we have to be incredibly cautious. We have a clear work from home where possible mandate. So I would urge all employers to stick to that because that's wise practice.
OK. Simon Calder, I'm very aware we've not come to you yet. There haven't been as many travel questions. We've got a whole section coming up on that. But I'd like to get your thoughts on that, this idea of mandatory restrictions. Other countries are doing it. What do they think of the UK when they look and they think it's all up to us to decide what we want to do?
Well, there is, whenever you travel around Europe or indeed further afield, there is this idea that the UK is taking a rather, well, certainly an outlier in terms of the restrictions in the UK. A lot of people I talk to who come to the UK, whether on business or to see family, are absolutely astonished at what they find. However, I think it's important to just put this into perspective. It's 3 weeks ago tonight that we first heard about this variant? Well, I'm sure our excellent medical figures knew about it, but it didn't even have a name then. About this time in the evening, we suddenly heard that there was going to be a flight ban on South Africa because of this variant, and look at where we are now. Since then, of course, the UK has put in some very tough rules. We had 11 countries on the red list. That ended at 4 a.m. yesterday, but we still have the pre-departure test that everybody turning up here at Newcastle Airport from abroad has had to take, and on top of that, so a pre-departure lateral flow and then a PCR test, and you've got to go straight home and self-isolate until you've got a negative result for that. And a lot of people are saying, well, actually, the rules for travellers are among the toughest in Europe, if not the toughest. The rules for just normal daily life are actually very relaxed. So there's a kind of bit of a mismatch. Having said that, I dare say half your viewers and possibly our excellent panel are all saying, why is anybody travelling at the height of a pandemic?
Oh, well, certainly a question we'll come to after the break. Thanks very much, Simon Calder there, and to our panel. You're watching a Sky News Omicron Q&A special coming up after the break. Bad news for many holidaymakers, but could there be more travel disruption to come thanks to Omicron? We'll be discussing.
Yeah, we heard the news this morning and it was pretty devastating, really. We've had to tell the kids they won't be going. We're frantically ringing around trying to claw back what money we can.
Welcome back. Now, it was perhaps inevitable. France closed its doors to British tourists just ahead of the ski season. The UK's nearest neighbour on the continent blames its huge rates of Omicron for the change. But this is largely down to effective British testing, identifying the variant. The question, Will other holiday destinations follow suit? Well, our Europe correspondent, Michelle Clifford, explains the implications of France's travel restrictions.
There will be something missing from the Lille Christmas market in the coming days. Many of the British tourists the traders usually enjoy seeing. France's decision to halt non-essential travel from the UK will mean lost profits, not just at the stalls, but from the hotels and restaurants in the city. A lucky few did make it into France before the new curbs come in. There was huge relief in the Lille Eurostar station.
I have terminal cancer, so this is my last holiday abroad. So I've got months.
We've come for the weekend to go to Disneyland.
I was really relieved that I was able to get here in time and not be told that I can't come here anymore, so I can see my sister who lives and works here.
But plenty of would-be tourists have been left devastated, including the Coles family, who should have been hitting the ski slopes of France this weekend.
I had to tell the kids they won't be going. We're frantically ringing around trying to claw back what money we can. Not just in terms of what the trip has cost us, but also COVID tests, transfers, skiing lessons, all of those things that we've booked that have come at great cost.
Christmas plans for thousands are likely to be affected, as come Saturday, people who are not French residents or citizens will have to have a compelling reason to travel from the UK. But the French government insists the measures are necessary because of high rates of the Omicron variant in the UK.
We will restrict the entry of tourists and business people without French or EU nationality. People coming to France from the UK will have to isolate themselves in a location of their choice for 7 days.
There won't just be emotional and financial pain for disappointed tourists, but for ferry companies and airlines, as trips are cancelled at what should be one of the busiest periods of the year.
The travel ban has affected us by effectively wiping out our Christmas season. We have around 22,000 passengers who are booked with revenue of roughly 2 million that we will lose.
France is taking a hard line against non-essential travel from the UK. Tourists hoping to spend some of Christmas here are being told to stay away. And the big question now is whether other EU nations will follow suit, dashing the holiday plans of many. The festive period may not prove quite as merry as many from the UK had hoped. Michelle Clifford, Sky News, Lille.
Well, let's go straight back to our guests with some questions on holidays. This first question I'd like to put actually to both Simon Calder and also Dr. Raghib Ali. So just bear that in mind, the two of you, as I ask it. Are we being penalised? I can imagine a disgruntled holidaymaker perhaps asking this question. Are we, the Brits, being penalised for being good at identifying the variant? So let's begin with Simon Calder on this. Do you think there's a political angle to this as well? Are we being penalised for being good at the science?
Well, I will leave that to our excellent medical team to explain that. But there is certainly a political aspect to all these decisions. And it became clear, actually, with the Transport Select Committee yesterday that the British government, like probably the French government, takes a political view of travel restrictions as well. But so interesting. I mean, the point that Michelle Clifford's report made there was, should we all be worried about the possibility that this is going to happen and that other places will look at our fantastic results from genomic sequencing and do the same? My view is that they won't. We had Italy last night coming out and saying, yep, you've got to do more testing. And that's the sort of response that I would expect perhaps from more countries as we get closer to Christmas, saying perhaps, you know, you've got to take a test closer to your departure. Maybe you've got to take a PCR test, which will be annoying and expensive and stressful rather than a lateral flow test. Maybe even when you get here, you're going to be self-isolating till you've got a negative test result. But something like a complete travel ban, as we've seen from France, I think is an outlier, and I do not expect that we will see that. So if you are heading to Spain, to Italy, to Switzerland, to the US, I would be prepared for travel changes to the travel, to the testing arrangements, but nothing else. And just on that subject, in that report from Michelle, we heard about somebody who was trying to claim back money from testing. Please don't book tests until the very last minute, because people are losing hundreds and hundreds of pounds booking tests that they simply cannot use, I'm afraid.
Oh, that's fantastic advice. Thank you, Simon. So don't book your tests until the last minute if you are planning to travel. And if you're going to countries like Spain, you may be OK. Well, let's put that question to Dr. Raghib Ali as well. Is it a little bit, the country, the UK, is now almost in a situation like someone who's turned on their Test and Trace app, and actually you're going to get pinged and you're going to regret having turned it on? We are good at identifying the variants, and so we get punished by other countries.
I mean, it's a bit like that. We do the most testing, certainly in terms of the genomic sequencing that allows us to identify the variants of any country in Europe. But we also do a lot more testing than almost any other country in Europe as well. And that's why when you compare these case rates, it's not a kind of a direct comparison. So we do a lot more testing, for example, than Germany, France, Italy, Spain. And if you adjust for that, it's likely that their cases are higher than ours. And Omicron is everywhere now. They may not be finding because they're not testing for it, but it's likely that their cases of Omicron are similar or even higher levels than ours. So I don't think it's fair to be having these travel bans. We've got ways of testing people now, as we do for people arriving in the UK, and I think all other countries in Europe should follow a similar policy. So you test people on arrival, and if you want to test them again on day 2, 3, 4, 5, of course, that's for each country to decide, but I don't think there's any justification for a travel ban. And the danger of that, as we've seen in countries like South Africa, is that people or countries will stop reporting when they find these new variants because they will fear that they are going to be penalised. And it damages particularly, countries, poorer countries. It damages their tourist industry. So I think we have to be really careful to, not to have these blanket travel restrictions and to move forward in the future with testing and quarantine where required.
Absolutely, a really interesting point there on where the political meets the scientific. Thanks very much, Dr. Raghib Ali there. More with our panel in just a moment, but next, the Prime Minister denied claims that he's introducing another lockdown by stealth in response to the alarming rise in cases. While telling people not to cancel Christmas, the Prime Minister's chief medical officer told the nation to exercise caution, cutting down on social contacts. And it calls some backbench Tories to accuse the government of allowing health advisors to run the show. Well, our deputy political editor, Sam Coates, has the latest on the arguments over the COVID restrictions.
1, 2, 3. Keeping the country moving in sync at Christmas. Boris Johnson still banking on the booster to save us from more curbs and more restrictions. Here at a vaccine centre in Kent this morning, celebrating 25 million jabs, which he boasts is keeping England unlocked.
We don't want to make your choices for you about your social life. We're not closing things. But what we are saying is people should be cautious and they should think about their activities in the run-up to Christmas. Nobody wants to get Omicron and be unwell and be forced to isolate.
The PM isn't forcing many measures in England, but others are tightening the screw and demanding more after another leap in daily cases. Medics are making clear behaving normally is too risky.
I wouldn't want to say to people they should do a particular thing, they should do this or they should do that. This is about saying to people, look, this is a period to prioritise.
Chief Medical Officer Chris Whitty clear that more restrictions could be on the cards.
But if it looked as if the vaccines were less effective than we were expecting, I think that, for example, would be a material change to how ministers viewed the risks going forward.
Today, the Prime Minister catching up with the Sultan of Oman, as many others suggested the PM could or should go further. Are there going to be more restrictions within days, Prime Minister? Few think the current situation can hold for long. Government scientists say that Omicron poses perhaps the most significant threat since the start of the pandemic. But Boris Johnson says that his relatively mild curbs are enough. MPs don't trust that he won't go further. However, I understand that discussions have taken place at the top of government about much more severe restrictions. But will the Prime Minister end up disappointing his party or his scientists? Tory MPs don't like what they're hearing from the scientists or the consequences that follow.
I fear that we are treading a path back to a full-on lockdown. We saw this last Christmas. Christmas will be fine, we were told. Then Christmas all of a sudden wasn't fine. We had the rule of 6, then it was down to actually no rule of 6, don't mix at all for huge parts of the country. And I fear history will repeat itself this Christmas. I very much hope it doesn't. But if we do go down that path, the government have got to have thought through the measures they are going to bring in to mitigate it.
That means help, lots of it, for pubs, restaurants and all those sectors hit by warnings to sit at home. Not least because limits have been put in place outside England. In Scotland, people have been told to limit gatherings to 3 households pre-Christmas, while more rules are expected to be announced in Wales tomorrow. Leaders of both nations want more financial help.
This now needs the urgent engagement of the Prime Minister and the Chancellor. We must not sleepwalk into an emergency that for both health and business will be much greater as a result of inaction than it will be if we act firmly and strongly now.
These people are doing what they're told and getting jabbed to stay free. But will Boris Johnson be able to deliver on his end of the bargain? Sam Coates, Sky News, Westminster.
You're watching a Sky News Omicron Q&A special. Coming up, with people staying home, the arts and entertainment industry faces another reckoning.
I'm Stuart Ramsey and I'm Sky's chief correspondent. Well, there's a real sense now that people are beginning to expect that this whole airlift is coming to an end, and they're really, really desperate. We saw snatch squads going in, grabbing people and putting them into trucks.
You either live and recover or you die.
Okay, so that's like a war.
That's the war, yes.
We help you understand the world with us. Over the past 24 hours, the soldiers have been attacked on a number of occasions. It's really sending a clear message that Venezuela is eager for change. We've been crushed. To take you to the heart of stories that shape our world. They were convinced the United States would become hooked. Well, they were right. An enormous explosion has just come down. I think it was a monster's just landed in between us. The information on this could bring down the entire network, not just in Iraq and Syria, but across the world. Thought I could throw a bit of pig withdrawn. It's so hot.
Hello again. Now, whether it's football games, theatre performances, Omicron is causing the closure of many events. And even for those productions that have managed to stay open, there is still the challenge of breaking even with empty seats. Well, our arts and entertainment correspondent, Katie Spencer, has been looking at the struggle for businesses.
We've been told to try to put our Christmas plans on ice. The tinsel's up, lights are twinkling. Should we even be out?
Not cancelling plans, a little bit worried about being out, but we're going to go ahead.
We've got his masks, we've got his sanitizer in his bags, we've got his COVID passes. So, yeah, I'm not worried at all.
The government has said it wants to avoid making choices for people, but don't mix if you don't have to. So does that mean we're entering lockdown by stealth? In London, it's certainly starting to feel like that.
We were actually meant to be going to France today to go skiing, so we've had to cancel that.
Shows are called off at the Lion King. COVID-enforced absences among cast and crew is the reason, and this isn't the only theatre that's been forced to put performances on pause.
leading voices within the industry are worried.
Audiences being put off from coming. We want to be healthy like everyone else. We want to beat this variant, but we also want to protect our businesses.
In lots of schools, Christmas celebrations are playing out virtually. For gigs and the live music sector, from cancellations to COVID passes, the consequences are crippling.
You've got people pulling out of concerts, you're having to cancel gigs because of musicians getting COVID, and so there's real uncertainty, and there's lots of organisations in the sector that are basically staring at the brink.
Of course, placing responsibility in our hands means the government doesn't have to take responsibility for businesses financially, which, through no fault of their own, are taking a big hit.
If our priority is to make it to the Christmas dinner table with family, we're told we've got to make choices about what we do and where we go.
After this week, I won't be going out anymore next week, so I want to keep everyone safe for Christmas.
Simple words, but with consequences that could prove financially catastrophic for those businesses that rely on people going out. Katie Spencer, Sky News.
Well, we've got a fair few questions to get through with our guests, now our expert panel. Not much time, so I'm going to ask you to keep it very, very brief as we go through these. The first question, given the apparent milder symptoms of the Omicron variant, are we overreacting? Let's put that to Dr. Claudia Paolini. You see this on the front line. Are we overreacting?
It's too early to say. We don't know. We don't actually have that data to say that it is milder or much milder. And even if it is, and let's hope it is, but a small percentage being affected and resulting in hospital admissions of a very large number because it spreads so much is still going to cause huge problems within the NHS and overwhelm us. And that will be a massive economic impact as well in itself. Because of the costs that will require to keep going.
OK. Professor Paul Moss, let's put that to you as well. Is the vaccine programme up to fighting Omicron?
Yes, I believe so. I mean, I don't think we're overacting. I think we're preparing for the worst, but hoping for the best. And the next 3 or 4 weeks will be critical in assessing how things go. So I think what we're doing is entirely right. We're trying to minimise contact and spread, and we're trying to boost immunity and get hospitals in great shape. So I think what we're doing is very appropriate. OK. The next question. Is Omicron just a less dangerous variant outcompeting the more deadly ones? Dr. Raghib Ali, given what you know about Omicron so far, does that sound right?
So we don't know yet. We've got data from London suggesting that both Omicron and Delta are circulating. In South Africa, Omicron has taken over from Delta, but they had very low levels of Delta in the first place. So we'll just have to wait and see really what happens in the UK as to whether, as has happened previously, Omicron takes over from Delta or the two co-circulate for a while. Just one other quick point I wanted to make. I mean, it's important that your viewers understand that their personal risk is much, much lower than it was this time last year when no one had vaccines. And I think it's important that people understand that we are much better protected, whether you've had 2 doses or 3 doses, you're in a much better position than you were last year. I know there's a lot of fear around, and the concern we have, of course, with the NHS is that we'll have so many cases in a short period of time. But for the individual person, you are at much higher risk. Of course, you should still take all the precautions we've been talking about, but you shouldn't be living in fear for your own personal risk.
OK, that's really good to know. We have a question here about the young particularly. How is Omicron affecting those, especially at a young age? I wonder, Dr. Claudia Paolini, if you've seen any evidence on that thus far.
No, there's still no evidence around that at the moment. But there's no reason for us to think that it's affecting younger children or younger adults any more so than the Delta variant. So, no, there isn't any evidence around that.
OK. Professor Paul Moss, do you want to add to that at all?
No, I'd agree with that. I mean, there was some study initially from South Africa. It seemed to be affecting children a little bit more severely, more hospitalizations, but I don't think deaths, thankfully. But we're not really seeing that in the UK at the moment. Of course, a great wave of Omicron does seem to be in sort of 20 to 40 or 50-year-olds at the moment. And we just hope that when it gets into the older population, who are highly vaccinated and boosted, of course, that they will be protected.
OK, thank you very much. We have, honestly, 30 seconds left for this. I just tested positive on COVID. For COVID, will I be able to see my family on Christmas Day? Dr. Raghib Ali.
I mean, of course, you have to go through the 10 days of isolation if you've tested positive, so you may just miss out on Christmas Day. But you will be able to visit them. This year we have got a 4-day kind of break from the 25th to the 28th, so you can just wait a couple more days and visit family after you've completed those 10 days.
OK, well, I'm sorry to have to make you deliver that bad news. Thank you very much. That is all we have time for in our Omicron Q&A special. It just leaves us time to say a huge thank you to our panel. They are or were Professor Paul Moss, Dr. Raghib Ali, Dr. Claudia Paoloni, and Simon Calder. Thank you. And thank you at home for all of your questions. I hope we answered them. Up next on Sky News tonight, Boris Johnson denies claims that he is imposing a lockdown by stealth.